Good morning, all. How are you all doing? So that is the question we asked a bit more elaborate way to the garment factory workers in South India. I am Dr. Sakthi from St. John's Medical College, Bangalore, and I am going to be presenting on the factors associated with work-related quality of life among garment factory employees from South India. So the textile sector in India is rapidly growing in the past 2 decades, and it contributes to about 14% to industrial production, 4% to the GDP, and gives employment to over 45 million people. Especially in South India, most of the garment factory employees are either intrastate or interstate migrants, mostly hailing from remote villages with half education or poor. They hail from a poor socioeconomic backgrounds and sometimes from problem families. WHO defines a healthy workplace is where the employees and the managers come together, collaborate to make it into a health, safety, and well-being are promoted in the workplace. And mainly the work well-being at the workplace is something which is not very much researched into. And with that, my study objective was to explore the factors associated with the work-related quality of life among the garment factory employees in South India. So it was a cross-sectional study done among 1,034 employees from 24 garment factories across Karnataka and Tamil Nadu. So in each factory, 10% of the employees were selected randomly and proportional allocation was done to make sure that equal representation among males, females, migrant employees and non-migrant employees were included. So we did interview using questionnaires to collect details on demographics, work details, and the work-related quality of life. I did my analysis using IBM SPSS software, and I used chi-square test, ANOVA, and logistic regression. So about the study tool which I used, it's called the work-related quality of life. This is a study tool which is developed by the psychologist in University of Portsmouth, and it's validated to be used in India. It's a 24-item scale where questions are asked on how the worker is feeling about different aspects of work life, and each scale is answered in a Likert scale where 1 is strongly disagree and 5 is strongly agree. The final score, which ranges between 23 to 115, and higher the score, it denotes that higher quality of life. Apart from this, the scale also includes subdivisions or sub-themes which looks at the worker's quality of life at career and job satisfaction, working conditions, general well-being, homework interface, stress at work, and control at work. So among the 1,034 employees we interviewed, the average age was 31 years. Almost 3/4 of the population was female workers. Around 78% hail from a small nuclear family. About 50% of the employees were currently married. The average income of that employee is around 9,000 rupees, and average experience in our study population was 3.5 years. If you look at the pie chart, which denotes that the red color shows low quality of life, the yellow shows average, and the green shows the higher work-related quality of life. So in our data, we found that almost 3/4 of the employees had higher quality of life. But when we look at the individual themes or the subdivisions of the quality of life, we see that each of these things have different spread of the low, average, and high quality of life. If you look at just the general well-being, only 55% are having high quality and the rest are having low or average. I just want to highlight 2 findings from this, where one is control at work, which shows that almost 50% of the employees feel that they don't have good enough control at their workplace. And almost 35% of the employees feel that they feel stressed at their workplace. So we thought, what are the factors contributing to this higher work-related quality of life? And we found that in chi-square test, factors like gender, family type, marital status, and whether they are from a problem family is significantly associated with their quality of life. Then for the continuous variables like age and education, we did a one-way ANOVA to find whether there is any associations. As we see, the average age group among low, average, and high quality of life in the employees, the age difference is gradually increasing. Similarly, the years of education gradually increases as we go from low to high quality of life. So we took all these factors and used it in a logistic regression model. And this gave us the significant predictors for the higher quality of life. So among this, age, education, being married, and being from a non-problematic family are significantly predicting to have higher quality of life at their workplace. So that shows that more the age and more the education, years of education they had, whether they are married and they are from a family without any problems like divorce or deaths. Coming to the discussion, almost 25% of the employees had low and average quality of life. This may be due to various reasons like they migrated from their hometown, they are living in institutional life in their hostels, sometimes conflicts at the workplace with supervisors, the business trend changes when the orders are getting high or low, or maybe the probable reasons.
Please conclude.
And one of the main things in the finding is the working conditions are really good. Most of the workers felt that the working conditions are good. And to conclude, most 3/4 of the population, even though they are having higher quality of life, factors like higher age, higher education, and being married are significant predictors. When we look at both social factors and the work factors, both should be targeted for the workplace well-being to be sustainable through the future generations. Thank you.
Thank you.